afternoon. I would like to thank our chairman and attendants, and also the board of the conference for this successful, great effort in this difficult time internationally for crossing between other countries. And I hope success for the next year also. First, I would like to give a comment about the inferior turbinate, which is now, it is a victim for the rhinology, not only in Egypt, but this is all over the world. And this is the situation of the inferior turbinate in the nasal cavity. And this is the nasal cavity is a slit. It is not a tube, which is very important to remember that when you do any surgery inside the nasal cavity, remember that the cavity between the nasal septum and lateral nasal wall, it is a slit and not tube like this. Almost of the surgery finished by this tube, which is a very difficult for the nose and for the patient. The aerodynamic system of the nose responsible by this anterior end of the inferior turbinate, which is responsible for the aerodynamic and distributed the air inside the nasal cavity for respiration and for ventilation of the sinus, and even upstairs, up for the olfaction. This is a very important strategical position and must be respected during the surgery. Don't forget that the anterior end of inferior turbinate, there is a specific site, size, shape, surface, and slit cavity between the nasal sinus and the turbinate. And even there is a deviation of the nasal septum, the inferior turbinate compensating to respect this split cavity between the nasal septum and the inferior turbinate. So if you change this physiological and anatomical position to this position, it is a very difficult job. More of the function of the nose are lost, like this. Also, now this is a big problem facing, and you can do any surgery for this nose after this surgery. Again, evacuate the nose. This is not Egyptian problem. This is actually, according to biological statistics, it is an international problem. And almost always respect this function of the nose. All this function from respiration down to olfaction is the responsibility mainly by the anterior end of the inferior turbinate. This is a comment, statement. Nasal turbinates play an important role in the physiology of the nose. Distribution of air during inspiration and expiration. And the nasal resistance, which is one of the very important functions of the nose. This nasal resistance, especially during respiration, during expiration, leads to positive pressure inside the nasal cavity, and this positive pressure inside the nasal cavity responsible for patency of the lower airway, patency of the respiratory tract, patency of alveoli. If you disturb this function, this leads to nasal obstruction and suffocation. This patient on your right side come for you and said, I have nasal obstruction in spite of this wide cavity, and at the same time, this patient feels suffocation because there is failure of full ventilation and inflation of the alveoli. Also responsible for the ventilation of the sinuses. This is as I said, this is not Egyptian or national problem, this is an international problem. And now there is what is called empty nose syndrome, international association, and responsible by this book. This is almost always, this is iatrogenic. This is done by doctor. Empty nose syndrome, this is iatrogenic. And in Egypt, the patient come for you said, بيقولوا لي أنت محتاج استئصال غضاريف أنف، من الاسم الغضاريف دي جت منين؟ مفيش حد يعرف. استئصال الأرفف الأنف, this is very difficult problem. So after evacuation of the nose like this, the patient complain of paradoxical nasal obstruction, wide nasal cavity, and at the same time sensation of the block of the nose, and dry mucosa, thickened crust, anosmia because loss of the airway inside the nose, poor voice, and respiratory dysfunction by suffocation. Actually, these symptoms doesn't appear before 2 years from the surgery, so the patient come late. And the second problem, there is no statistical study about the incidence of this disease, new disease. And as we see, this is a problem. And many suicidal recorded by Kern that there is due to this iatrogenic disease. So it is a very difficult if you're looking this nose to change to that nose. Any surgery for this nose cannot improve because the nasal cavity is a dynamic process and not static. And just to tell the patient, please take these 2 cottons and put your nose and to warm the air. Again, this is a lady create this idea to warm her nose. Okay, so in message, very simple message, please respect the inferior turbinate, and if you do surgery, be very conservative to respect the slit shape of the nasal cavity between the nasal septum and the inferior turbinate. And don't forget that the inferior turbinate is an organ most responsible about all the physiology of the nose. And thank you for your attention.